Dear students, Assalamu alaikum. Hope you will be fine. Today we are going to study a very important topic, that is coronary heart disease. Okay, what is coronary artery? First of all, I will tell you that coronary arteries are the arteries which are supplying blood to the tissues and muscles of the heart. As I told you in my previous lecture, when we were studying, I told you that from the left side of the heart, the oxygenated blood is supplied to the whole body through aorta. Okay, this one is aorta, which is supplying blood to the whole body. Okay, now what happens at this aorta? Start from heart. First of all, two very important arteries move or divide, you can say, from this, come out from this aorta. So I am making a clear diagram here. For example, this one is heart. Okay, I'm not dividing in the chamber, so there, okay, I'll do divide, so there will be many lines still. This one is aorta. Okay, from aorta, two main arteries are coming into the tissues and muscles of the heart. So these are supplying basically blood to the tissues and muscles of the heart. Why? Because you already know a heart is supplying blood to the whole body, so even the tissues and muscles of the heart, they also need oxygen and nutrition for all activities, so heart can work properly. So for that, food required and oxygen is also required. So these coronary arteries are supplying oxygen and nutrients to the tissues and muscles of the heart. Okay, now what happens? These arteries, these are already very narrow arteries. So if there is any blockage in these arteries, so what will happen? The supply of the food and nutrition and oxygen to the tissues and muscles of the heart will be affected. Okay, so what will happen in that case? In that case, we can experience two problems. One is called angina and second one is called heart attack. What is mean by angina? Angina is basically a chest pain. So what happens? For example, if a person is at rest, so at that time that person will be able to get oxygen and nutrients. But if that person is doing walk or exercise or any other activities, any other hectic work, so what will happen? The supply of oxygen will be not proper to the tissues and muscles of the heart. So as there will be less supply, so a person will feel pain in the chest, and that is called angina or chest pain. Okay, if blockage is more, then the part of the heart which is not receiving oxygen and nutrient can also be damaged. For example, if the blockage is in this portion and this area of the heart is not receiving oxygen and nutrients, so the less area is affected. But if the blockage is here in the main part, then it's mean the whole heart is, nearly the whole area is not able to receive oxygen and nutrients, so the damage can be more. So it can also cause heart attack, and many times patients suffer from coronary heart attacks or diseases, and it is also a cause of death. Okay, now what is the chances of survival? The chances depends on the part of the heart which is damaged. If less area is damaged, then the person can be better with the treatment. But if the more area is damaged, then sometime it can cause heart failure. So there are many treatments for that. So we'll discuss. First, I told you that it can be, this coronary problems can be of two type. One is called arteriosclerosis. Arteriosclerosis is a condition in which arterial walls become thick and hard. When wall become thick and hard, blood will go, then it will not properly dilate. It will not properly supply blood to the tissues and muscles of the heart. Second condition is called atherosclerosis. What is mean by atherosclerosis? Atherosclerosis mean, for example, this is a narrow artery which is coming, so there can be fatty deposit in it. When there will be deposit, so it can easily stop a clot there. So as it can stop clot, the supply of blood can be again stop. Okay, so in this way it can be very harmful. Okay, now what is the treatment which can be given to the patient? So these days one of the treatment is called angiography. Angiography is a process in which without open heart surgery, what doctors they used to do, one thing is angiography, second thing is angioplasty. In angiography, what happens, from the artery of a leg, doctors send a very narrow wire into the artery of a patient, and that wire is move along with the blood circulation. It goes to the heart, it goes to the coronary arteries and other arteries. If there is any blockage, then can be removed. Secondly is angioplasty. What is done in that? A balloon is also along with, even in angiography a balloon is also along with that wire, a balloon is there. So when it reaches to the affected area where the blockage is, so that balloon is dilated. So what will happen, it will move, it will push that blockage and it will remove that blockage. Sometime what happen in angioplasty, along with that wire, we can also add stunts or a spring like thing. That spring will fit into that artery, and in this way that pinched portion will be corrected and blood supply can be done there. So this is called angioplasty. So these days, due to angiography and angioplasty, we are treating these problem, but it depends how much blockage is there. If the blockage is more, then heart bypass. What happen in bypass? What happen, for example, here is the blockage. So what scientists they will do, what doctors they will do, they will graft an artificial vessel here. Not artificial, basically it is taken from the leg of the patient, and it can be bypassed from this area. So this area will be stopped, finished. So now the blood supply will be from that bypass to the other vessels. So in this way different treatments are available. Okay, now if there is a clot in any artery, then that is called thrombosis. So that clot, if that clot is in the coronary artery, then I told you that can cause heart attack, and if it is in any other artery, so it can cause damage according to the place where it is located. Okay, so here in the diagram, the two arteries are shown here. One is the normal artery. So that is the normal artery. I already told you that a thick muscular layer is present. The lumen is already narrow in the artery. So here they are showing you an affected artery or an abnormal artery, and in that artery they are showing you that here the fatty deposit is present, and due to that fatty deposit the lumen is very very narrow. Okay, so this is a condition of a person which who is having abnormal artery. This one is the condition of a normal artery. Okay, now they are asking certain questions and you have to answer these questions. For example, first they are saying study the figure above and state the difference between the two arteries. So what are the differences? You can find here, this is a normal artery. Here the lumen size is okay, but here much deposit is present here and the lumen size is very narrow. So and its elasticity will also be affected. Okay, now they are asking the question, which of the two arteries do you expect to have a higher blood pressure? So automatically the answer is this abnormal artery will have the higher blood pressure, as due to this deposition and hardening the flexibility of this artery is affected. So as blood will go here, so much pressure will be exerted. Okay, now they are asking the question, the condition do you see in the abnormal artery is called atherosclerosis. Name one factor that may cause atherosclerosis to develop. So what is the one factor, just one factor you have to tell? So that can be the fatty foods or food which is high in cholesterol, that can cause this condition. Okay, now the next question is, what do you think might happen if atherosclerosis occur in? Now if this atherosclerosis is occur in in the coronary artery, the to that begins oxygen rich blood to the heart, rich blood to the heart muscles. Okay, now they are saying if this blockage is in the coronary artery, so what can happen? So as you can see, the supply is very less. So first of all, it can cause angina or chest pain. In second condition, or in a more higher problem condition, so it can cause heart attack. Okay, if this condition is the arteries bringing blood to the brain, and if this artery is taking blood to the brain, then what can happen? So again, the brain oxygen supply, nutrition supply to the tissue and muscles of the brain will stop. That can cause many other problems. Sometime if that blockage is there, then it can also causes brain hemorrhage, this is the one of the reason, you can say effect, then it can cause the brain hemorrhage. Okay, now they are saying atherosclerosis begins early in life. So what should we do? We should have a proper diet for that reason. So how can we reduce the risk of atherosclerosis? So what should we do? The food which is rich in animal fat should be avoided. Animal fat have high cholesterol level, so it can accumulate into the arteries, so it can narrow the this lumen of the artery. So we should avoid animal fats. Instead of that, we should use oil, and even their amount should also be very less. And we should do this. And other factors which can increase the risk of coronary heart diseases can also be stress, can also be smoking. How stress can also causes high blood pressure, and high blood pressure can cause different types of problems. In the same way, smoking has many harmful effects. One of the effect of smoking is that it hardens the wall of the arteries. It called thickening, and it can will harden the wall of the arteries, so it's mean their flexibility will be affected. So arteries will not dilate, arteries will their elasticity will be affected. When the elasticity of the artery will be affected, then ultimately the blood pressure will increase, then it can cause different types of hemorrhages. High blood pressure can also cause many other problems, and even sometime it can be very dangerous. Okay, so these are different things which should be avoided to prevent these type of issues. We should what we should do, we should use low cholesterol food, we should do exercise, we should prevent alcohol, we should control our sugar. So we should avoid diabetes. Sometime family history is also a reason which can cause such type of problems. So we should try to control all these things with our diet and exercise. Okay, so read this topic. If there is any problem, you can ask. Okay, thank you. Allah Hafiz.